Welcome to Medical Myths, Legends, and Fairy Tales. I'm your host, Dr. Alan Christensen. Look, you know that between the latest online fads and the crazy media headlines, it's easier than ever to get confused about your health. And you and I just want to feel better and live longer. We want to know what works. And we can't wait for further studies. We need to make decisions today based on the best evidence we've got. Well, that's exactly what this show is here for. So let's get to it. Hey, Dr. C here. Welcome back to another episode of Medical Myths, Legends, and Fairy Tales. So, big topic. I've heard some buzz lately about the thought that breast implants could cause thyroid disease, and that taking them out may be the only solution for those who have Hashimoto's. So, if you have them, what do you do? If you're considering getting them, what are the risks? Who's more at risk than others? This is honestly one of the topics of all these ones that I've covered that leaves quite a few questions unanswered. In all honesty, I looked at a lot of the medical literature, and I was really glad to spend time to speak with a good friend who's also a world-renowned plastic surgeon. So I was joined by Dr. Anthony Youn. He's known as America's holistic plastic surgeon. He's a board-certified plastic surgeon, considered one of the country's just best-known experts on looking younger with or without surgery. He does over 150 breast implants per year. And the really cool thing is that despite him being in a situation in which he could have a lot of bias, I don't think he did. He had a pretty fair appraisal of the literature that I saw, and of course, many insights that I did not have. So please enjoy the discussion I had with Dr. Tony Youn. Tony, how you doing, bud?
I'm doing great. Thank you so much for having me. This is a very important topic for a plastic surgeon like myself and for my patients as well.
This is a super important topic, and I really appreciate your time and expertise. I've dived into a lot of thorny issues on this podcast already, and I got to say, I've spent some time in the literature on this one, and it's one of the ones that I think lends itself to fewer straightforward answers than many.
Yeah, and it's a hot topic because every year upwards of 400,000 women undergo breast augmentation. It's the number one most popular cosmetic surgery, and it's been number one ever since 2006 when the FDA lifted the moratorium on silicone breast implants. And obviously it has also created quite a bit of controversy, especially the last couple of years.
And there's been a couple cycles with this, it seems like. There was a wave in the 90s, and now we're seeing the concerns resurfacing.
Yeah, and it's interesting because, for me, I trained as a very classically trained plastic surgeon. I did 4 years of medical school, 3 years of general surgery residency, 2 years of plastic surgery residency, and then I did a year of fellowship. And through all my plastic surgery training, we did a lot of breast implant surgery. I do probably 100 to 150 a year. And up until the last couple of years, last few years, I haven't really thought that much about breast implant illness because everything that was told to me and that I looked at in our literature was that it doesn't exist and that this is in people's heads. And it wasn't until I really looked at these studies, until I really heard those stories from thousands of women who are saying, this is real. I'm having issues with my silicone breast implants, that it caused me to really go back and look into all the literature on both sides to determine, what really is going on here?
So what I'd love to have us do in our discussion is get some clear ideas people can take away in terms of if they might be a concern for them, and especially thinking about those that have autoimmune disease and autoimmune thyroid disease. When should they be concerned about their implants affecting their health? How should they act on that? Would removal be useful for them? So let's dive into what some of the main points of confusion have been.
So, you mentioned before that this has gone in cycles. Back in the early 90s, there was concern that silicone breast implants were causing autoimmune disease. And so the FDA put a ban on silicone implants in 1992. And then they had the big Dow chemical crisis, and they went bankrupt and lawsuits and all of this. And throughout all that time, plastic surgeons said, hey, there is no proof that these implants cause illness. So over the ensuing 14 years, the FDA did conduct studies. They call them the core approval studies, post-approval studies in the United States, to determine whether silicone breast implants truly cause these types of autoimmune symptoms. And in 2006, the FDA ruled that they don't, and they lifted the ban. And at that time, plastic surgeons said, hey, this is proving that we were right all along. And the implants, as I've mentioned, have become very widespreadly used to the point where now upwards of 90% or more of breast implants used throughout the United States are silicone implants. But over the last couple of years, there has been, through the power of social media, groups of women, tens of thousands in some cases, who've gotten together saying that we don't believe the dogma that silicone implants don't cause illness because I'm suffering from that. And over the last couple of years, there have been a handful of studies in the rheumatologic literature that appears to support that. And a huge study coming out of MD Anderson last year from the Annals of Surgery, almost 100,000 patients, showing a possible connection between silicone breast implants and certain autoimmune diseases. And so this has become a super hot topic. There are plastic surgeons on one side that still say, no, there's no connection. And then there are lots and lots of women saying, how can you tell me that what I'm feeling is not true?
Well, and a tricky thing is that everyone's experience is valid. And at the same time, there are issues that occur in large populations. So I don't have a real bias here, but if there were a connection or not, there still could be overlap between, say, you've got 1 million women that don't have implants. Some of those women will get autoimmune disease. And
exactly.
Yeah. So there will be some cases in which there's correlation, but not causation.
And that's where more studies really need to happen. And so the studies that we look at, that plastic surgeons look at these are funded by breast implant companies, and
Sure.
They are conducted by plastic surgeons who are paid, in some cases, hundreds of thousands of dollars by these companies to perform these studies. Well, these studies don't appear to show a connection between implants and autoimmune disease, but are they truly looking for that? Are they asking patients, do you have symptoms like hair loss, like rashes, unexplained rashes, like muscle aches, brain fog? Well, they're not necessarily asking those questions. They may look at if they have a diagnosis of autoimmune disease, but they're not necessarily asking those specific questions. And I think that's what really needs to be done. We need to have large studies now that look at women with and without implants and asking these specific questions to see, do women after undergoing breast augmentation develop these types of symptoms in a higher, percentage than women who obviously don't have implants?
Right. And that's an important distinction because there's certain garden variety symptoms that occur in about 20% of the population for no reason. And that can include many, many vague symptoms. As I was looking through literature, though, I saw many studies that would talk about these vague groups of symptoms that often do come and go anyway. And then I saw just a particular case report of from South America, a 23-year-old woman that was written up, and it included images. And she had this obvious severe rash that was exactly over the breast tissue and nowhere else. Mm-hmm. So there's things to where, wow, that's pretty straightforward, probably a factor, and other things to where you could think, shoot, that could be from anything.
Well, yeah, and it's, is she wearing a special bra afterwards for her breasts? There's so many factors that can come into play. However, like I said, there are some studies coming out, mainly in the rheumatologic literature, that do appear to support a connection between certain autoimmune diseases like Sjogren's syndrome and scleroderma and women with silicone breast implants. And there are even some studies, smaller studies, showing anywhere from a 50 to 70% plus improvement in their symptoms after silicone breast implants are removed. And honestly, I've seen this in my own practice. What I'm seeing does seem to correlate with some of the literature, where if women appear to have rip-roaring autoimmune disease, I have women who've come in to see me and say, I've had lupus and rheumatoid arthritis for the last 15 years. It's been debilitating. Do you think it could be due to my breast implants? And we've taken their implants out and their symptoms don't seem to improve. However, women who say, hey, I've had breast implants for 3 or 4 years. In the last 2 years, I've developed these weird rashes and my hair seems to be falling out and I've got these muscle aches. We take implants out of them and a good percentage seem to do better. And that does appear to correlate with some of the studies that are coming out as well.
I did see some that said similar numbers to what you mentioned, 60 to 80% improvement, but then also arguing that those where it was more advanced and entrenched autoimmunity, that there would not likely be improvement without there being some other direct therapy for the autoimmunity, some immunosuppressive therapy.
Exactly. I think where my concern lies with, breast implant illness. And so, I did a podcast on this myself where I really took the time to look at the studies and to say, okay, look, if I'm looking at this, and for me, I'm a plastic surgeon, I make no bones about it. I do breast implant surgery. But, if I made the decision myself that I felt that breast implants were dangerous and patients shouldn't have them, of course I wouldn't do the operation. I'm not paid by the implant companies. I'm not one of their researchers. But I really wanted to go down. And my wife even said, she said, if you're going down this road, you're doing all this research. And I actually went to the websites of breast implant illness websites where they state all their studies. I went and looked at all of these and compiled it. And I came in from a perspective of, here, I'm a plastic surgeon. I've looked at the plastic surgery literature, which doesn't appear to support this. Let me look at their literature. Let's put it together and let me make what I would think would be an objective decision. And my objective decision from looking at all of this is I believe that it's real. And I think there's probably a fairly small percentage of women who do develop these types of symptoms from their silicone breast implants. And it does appear, we don't know exactly who's at risk. There are some studies that look at possibly people who have a history of autoimmune disease or a history of severe allergies may be at higher risk than the general population. And so for those patients, I warn them and I say, we don't know if this is the case, but if you've got a history of autoimmune disease, if you've got a history of severe allergies, you may want to reconsider silicone breast implants.
Now, is that breast implants in general, or is that silicone breast implants?
Well, so, there are silicone and saline-filled breast implants. Saline implants do have an outer silicone rubber shell. The problem is that I've not seen any studies that have looked at saline breast implants and these types of symptoms. They've all been silicone-filled implants. And so studies do need to be performed with saline implants. The problem nowadays is that saline implants are not being used all that commonly anymore. And so we don't have the answer for saline. And so I do tell patients, if you really want your breast implants and you are concerned about autoimmune disease, you could consider going saline, but we don't have studies to necessarily tell you that your risk is lower. Or if you switch from silicone to saline, are your symptoms going to go away? We don't know. There aren't any studies, at least that I know of, that have even looked at that.
So one action point I heard is that, and this is hypothetical, and you couched it as such, is that if women were really prone to allergic diseases, so airborne allergies, asthma, eczema, things along those lines, and or significant autoimmunity, they may have risks by receiving implants that are greater than the general population would.
That's what I postulate, because there has been a study or two that have looked at that. But once again, you're not looking at large numbers of patients. That's the problem, and that's where really we need to do more studies. And, I commend, I just got back from the annual meeting of the American Society for Aesthetic Plastic Surgery. And, they're the biggest group of board certified cosmetic plastic surgeons. And once again, the dogma in plastic surgery is what I've heard from patients. I had a patient tell me the other day, she said, I saw this older plastic surgeon. I told him that I had breast implants. I was having these symptoms. And he said, I need to see a psychiatrist. That was his recommendation. And I thought, are you kidding me? So this is the first time they actually had a panel on breast implant illness. And the president of the society actually said, a year ago, I would have told you that I don't believe any of this. He goes, but I went to the FDA hearings back in March. I heard these stories and I've looked at all of this and I think there's something here.
Wow.
And that's a big deal in our field because the dogma is that silicone breast implants are safe and that they don't cause these types of symptoms. Well, things are changing. And I think that's where the power of social media and the power of women telling their stories, each woman who tells her story is very important because all of that combined, those voices combined, can change things.
So any ideas on if a woman has implants? What are some symptoms or concerns or findings that might make her think that they're affecting her health?
Well, it's interesting because this isn't something where, in general, if you have silicone breast implants, that the next day you develop these symptoms. Most of the time, when you look at women's stories, it doesn't happen for at least several months, if not even a couple of years sometimes. The first thing to consider is just like what you said before, is that autoimmune issues happen in lots of people, and implants are only one possible cause. So what I recommend, unfortunately, there isn't a study that can, there isn't a blood test that you can take that will tell you if you're reacting to your implant or if you will react to implants if you have them put in. So I would start by looking at your own past history. And once again, if you've got a history of autoimmune disease, if you've got inflammatory or allergic type of skin disorders, that type of thing, then you may want to rethink it. If you've already got breast implants, and I tell my patients, look, if you're happy and you're healthy and you have breast implants, then I don't think there's any reason to necessarily switch them out. Or to take them out, because there is a 96-ish% satisfaction rate with breast implants, and that's why I myself feel comfortable still putting them in patients, is because I don't think it's the majority of the population that react to these. I think that there's a small percentage that probably do, and we just don't know who those people are. If, however, you do have breast implants and you do have some of these symptoms going on and you think that they may be caused by your breast implants, then obviously you want to see a rheumatologist. Ideally, you can even see a functional medicine physician. See if there are other types of reasons why you may be having this. And if it really comes down to you love your implants, but you are sick, then maybe the time has come to take them out. But that's also where you start getting into a bit of controversial territory, because there are operations that are being recommended that are quite invasive, not just removal of the implants, but removal of extra tissue as well.
Oh, wow.
And that's where I have some issues, is that there are breast implant illness advocates who are recommending quite invasive, drastic operations to remove the implants along with the scar tissue surrounding them that can be very invasive and create very lengthy scars. And I don't know of any studies that have shown, it's called en bloc removal of implants. I don't know of any studies that have ever supported that that's the way to go over just removal of the implants or removal with scar tissue removal separately.
So their thought is that there's, I'm assuming, some silicone residue in these adjacent tissues that could still be immunologically active, or?
Yeah, so the thought is that if you're going to remove the implants, you should remove the implants and the surrounding scar tissue all in one piece. And if you, let's say, remove the implants first and then the scar tissue separately, even in the same operation, you could get spill of these contents into the body, and maybe your symptoms won't go away. The problem with the en bloc, which is removal of all of it at one time, is that you essentially have to do a mastectomy type of an incision, which you could take an incision length from 4 centimeters to 10 to 12 centimeters. On top of that, too, depending on where the implant sits in the body, some of the back of the scar tissue may be adhered to the lungs, not the lungs, to the ribs. And it can be quite hazardous to remove some of that scar tissue to the point where you could puncture somebody's lung in the process of doing that. Okay, so we have to look at of risks versus benefits. And yes, if we knew that leaving some of the scar tissue behind would definitely, cause the person's symptoms to continue, or there was a high risk of that, then by all means, we need to consider the risk versus the benefit. But right now, there are no studies that I know of that show that en bloc resection is better than removing the implant and then the capsule separately with a much smaller scar, or that you have to remove all the capsule anyway. This is kind of people's beliefs, but when you're using those beliefs that are not supported by science, you could be putting people at risk of, once again, puncturing their lung, having these large disfiguring scars, and for what benefit if that benefit has never been proven to actually be there?
Wow. And the surrounding scar tissue is a normal part of the procedure, correct?
Yeah. So what I do, if I have a patient who says, look, I'm just done with my implants, we can take the implants out and a portion of the scar tissue to allow that pocket to close down, because all implants have some type of scar tissue around it. But there is a belief in some circles that you have to remove all of the scar tissue, otherwise their symptoms will persist. And that's where I have not found any type of science to support that.
Mm-hmm. So something else I saw some data around was the anaplastic large cell lymphomas and the debate about textured and smooth implants. Any comments that way? Or?
So that's, some people get those mixed up because that's completely separate from breast implant illness, but they're both very hot topics right now. So anaplastic large cell lymphoma, ALCL, is a rare type of cancer or they call it a lymphoproliferative disorder, but essentially it's a cancer of the scar tissue, the capsule surrounding a breast implant. And right now, the hypothesis is that if you've got a textured breast implant, so breast implants can come in two types of shells, outer shells. There can be a smooth shell or one that's sandpapery, textured type of a surface. And the idea that the hypothesis that we're working on now is that if you get bacteria that sits in those crevices of that textured shell, the bacteria can stimulate the lymphocytes of the surrounding scar tissue. And after years of stimulation, those lymphocytes can become cancerous, lymphoproliferative. And in those cases, it's very slow growing. In the vast majority of cases, if you remove the scar tissue, the capsule with the implant, that's curative. But there have been some cases where the scar tissue hasn't been removed and the cancer is actually spread, and people have died from it. Not a lot, but people have. Last I heard, there have been 457 confirmed cases in the United States. In Australia, for some reason, there's a very high incidence of it, upwards of 1 in 3,000 or less, or more technically. Yet in Asia, there's 0 cases in all of Asia. So it appears to be very multifactorial. Part of it may be genetics. Who knows? Part of it could be some environmental issues that are working with this. But what we do know is that all of the confirmed cases have been related to a textured breast implant. And so for that reason, I stopped using those implants in my practice a couple of years ago.
So given the role of bacteria, is there any variances in surgical technique that could be relevant?
Oh, yeah. And that's something we've been doing for a long time with using different antibiotic rinses and all that. There's a lot of studies going on with the different bacteria that they're culturing out from this. So that's definitely on the forefront of plastic surgery. But honestly, I was surprised there was a question of whether the FDA was going to take textured breast implants off the market. They've been taken off the market in other countries. And a couple of weeks ago, the FDA announced that they were not taking them off the market. So I myself, like I said, I don't use them. I discourage patients from using them. I have something on my website called my Holistic Beauty Blacklist, where I discourage people from doing this. And that's one of the things is textured breast implants. The argument of using them from plastic surgeons is that some of them feel they can get better results with it. But, for me, the results, okay, your breasts may look or feel a little bit nicer in certain cases with it, but now you have to worry that these implants could be essentially a ticking time bomb. Sure. And it doesn't make sense to me.
Any specific data that you're aware of on thyroid disease or Hashimoto's? I did a literature search myself, and I've only found one report of 2 cases. It was a case series report, and they were written up. There was a large gap of 15 or more years between the surgery and the onset of thyroid disease. There wasn't really a clear story that the explantation improved the thyroid disease, so it didn't sound like much either way. But given that there's a plausible autoimmune risk, I could see the relevance. But any other specific data that you're aware of? Or?
No, Hashimoto's is not one that has come up with any of the studies that I have looked at. Quite often it's rheumatoid arthritis, fibromyalgia, Sjogren's is quite commonly brought up, as well as scleroderma. Hashimoto's is not something that I have seen much with it, nor have I had patients who have, that's been a conversation topic. But also I think a lot of people have Hashimoto's that it's not diagnosed.
Yeah.
And so, is there something there that just hasn't been studied? That's definitely possible. I think that what we have looked at, the studies with breast implants for the most part have been from surgeons and breast implant companies. And surgeons, we have kind of tunnel vision of, we look at complications as physical complications, capsular contracture, implant rupture, hematoma, infection. We don't know enough about a lot of these other types of issues in general that we don't look for those. And I think that's part of the issue is that it really needs to be a multi-specialty approach to breast implants. And that's where they really are going in that direction finally now. And I really commend those doctors who are now performing these studies. It's because it's definitely necessary because, so many women have breast implants and so many women love their breast implants. Once again, the satisfaction rate is so incredibly high, but we really need to make sure that we can properly educate patients about the risks, and hopefully we can figure out why it is that some women appear to have, issues with them and other women don't.
There was a couple of rather prominent testimonials written on the website. There was one that I found of a woman who talked about how she felt that her implants were the cause of her later developing Hashimoto's, and that she argued that her levels were much better after they were taken out, and her scores weren't too different before or after. And yeah, if anyone does have Hashimoto's, I want you to feel your best, but I don't see compelling reasons to think that just going out and doing a surgery would be necessary unless there were other valid reasons making you think that the implants weren't working well.
No, I agree. And I think that's where, it's one thing if you say, look, I just don't want my implants anymore, then no question, get them out, and your surgeon should take them out for you. That's not a question. The question comes then to, is it going to benefit my health if I have my implants taken out? And that's where, just like you said at the beginning of this program, is that we don't know necessarily, who is going to benefit or not. And so what I recommend for my patients is, look, if number one, if you want to take them out, we just take them out. We don't have to discuss, whether it's going to make your symptoms better or not. If you want them out, then the answer is always yes, you can have them taken out. That's your right. But it's those patients who say, I don't want to take my implants out, but I'm sick. What should I do? And that's where it becomes difficult. And so once again, I think we need more studies. I think that in the end, I do think that if you are sick, there's nothing more important than your health. As much as, as a plastic surgeon, I know how feeling good about your appearance can help you feel good about yourself and can improve the quality of somebody's life. But if you're unhealthy and there's nothing else that we can point to, then by all means, let's take those implants out. If we can, let's remove the scar tissue around it. But at the same time, let's do this without necessarily going overboard and doing unnecessarily invasive operations.
Just to expand on a point that you touched on a bit ago about no real good predictive tests, I remember back in the 90s, there were some labs doing anti-silicone antibody panels, but I remember seeing that they had very poor sensitivity and specificities. Any comments about tests that might exist or did exist?
Yeah, this is something that plastic surgeons never talk about. But recently I did find out that there is a silicone antibody test that people can take. The problem, at least from the person that I spoke to about this, is it's extremely expensive, and it's upwards of $3,000 to $4,000 to get this test done. And so is it really, how many people are going to pay for that? I can't imagine insurance is going to pay for it. So that I think is going to be the barrier for a test like this. There have been, interestingly, back in the 70s and 80s, there were some studies that looked at silicone breast implants and autoantibodies basically to collagen. And there were some studies showing that women who've had breast implants put in appeared to have a higher or more enhanced cellular immune response to their own collagen or antibodies to collagen. And these are older studies, like, I think 80s or 90s. But it was the first that I started hearing about that. And, and there you go. It's antibodies to your own collagen. And that could be the reason why we're seeing a lot of these types of skin eruptions and other types of symptoms.
Well, the tough thing about testing and about antibody tests in general is that they're squirrely and they're up and down. There's a lot of random variation with them. And in many cases, they may not even represent an immune attack. They may represent an immune accommodation. They may be exactly a good thing happening, maybe a sign of your body showing tolerance to something. And even further, there's times to where they can be present in situations in which they're bystanders. This is something people often don't know, but like thyroid peroxidase antibodies, for example, they don't actually cause Hashimoto's. Those aren't antibodies that damage the thyroid. Those are smoke that often goes with a fire, but the presence of them are not the drivers of the overall autoimmune process. So yeah, antibody tests are really tricky.
Yeah, and I think when you're also looking at breast implants, so much of it is such an emotional thing for women. And there's so many plastic surgeons who have not listened to women's stories, and women have, just like this patient of mine who saw the doctor and he said, oh, you need to see a psychiatrist. That was his initial response. It's not, wow, hey, tell me more about your symptoms and let me do some research. His first response is, you need to see a psychiatrist. And how insulting is that, And so I'm not surprised with how plastic surgeons have really dropped the ball with this, that there are women who are getting together and who are angry and feel like they have not been heard because they haven't. And that's where hopefully now things are changing, and there are doctors who are more open to the fact that this is real, that breast implant illness is real, and that women are having these symptoms, and that we can help a lot of them to get better. And then secondarily from that, educate women who are thinking about breast implants so that they know what their risks are, and they know that if they're going to undertake this operation, that there are potential other issues other than just bleeding and infection and capsular contracture that can happen.
Well, this has been great. So yeah, there's some factors that might make some more at risk than others, and possibly existing autoimmune disease, existing allergies could be amongst them. I loved how you made it very clear how your response has been that if a woman wants hers out, your patients, you're happy to accommodate. So I think there's a lot of stress that can be taken off just by knowing that that option exists, and that, a woman wouldn't have to feel that if she did decide this were something that were harming her, that she was stuck with them, that she did have that option available.
And I think it's important too, just to jump in here, is
please.
that there are plastic surgeons who are going around and they don't believe that this is real. I've heard that from many plastic surgeons saying, it's not real. And if you look at some of the information coming out of even the plastic surgery societies, it's saying that these are safe. But we have to also keep in mind that there's going to be a bias. If
Sure.
you're doing, if you're making hundreds of thousands of dollars a year on breast implants, there is that underlying, drive for you to want them to be safe. And I want them to be safe. I do a lot of these too. But at the same time, we really, if you've got these types of issues and you see a plastic surgeon and they don't take these issues seriously, and they, tell you that it's in your head, or that, the studies don't support breast implant illness, then they're wrong. And you should find another plastic surgeon who's going to work with you with your symptoms, because there are doctors out there like the one I mentioned, who really shouldn't be taking care of women with breast implants. They just shouldn't.
Yeah. So you've got options, but then for those who have the implants and are wondering if they need to take them out, they're healthy, really, no, you don't. But then those who have symptoms, then the thought is, well, if there were autoimmune issues, you'd want that diagnosed. And given that many can still have symptoms even after removal, like Tony said, you'd still want to sort out whatever other factors there could be. And it could even be multifactorial. Even if the implants were part of this, there could be other issues driving the immunity. So you still want to really dig deep and sort those out and address those along the way.
Yeah, and I would keep in mind, number one, if you just want your implants taken out, then by all means, you don't have to struggle with that decision of should you have them out. If you want them out, and if you feel better with them out, then by all means do it. It's just if you love your implants, like so many patients do, and you'd hate to get rid of them, then no question, look for other potential reasons why before you take that potentially drastic step. Because hopefully you can have your cake and eat it too. This
has been awesome. Those of you who'd like to learn more from Dr. Youn, he's done a podcast on this in some more detail as well, and tons of more great things on his website, dryoun.com. We'll have that in the show notes, but dryoun.com. And Tony, any closing words or points that we didn't get to? Or
yeah, I think the thing I would just say is to educate yourself. And there's so much information out there, but look at both sides and make sure that the decisions you make are based off of science, and that there are studies to support what you're planning to do, because there's so much out there on both sides that is based off of emotion, that's based off of personal biases, and really do what you feel is best for yourself. That's really the most important thing, and do the research, do your homework, because in the end, you're in charge of your own body.
Dr. Anthony Youn, awesome stuff. Thank you so much.
Hey, thanks, Alan. This was good. Appreciate it.
All right. Take care, everyone. Back with you real soon. In the meantime, take great care of yourselves. Hey, Dr. Christensen here. Thanks so much for joining me for another episode. Is there a topic you'd like me to cover? I'd love to hear from you. Just go to Dr. Alan Christensen on Facebook or Instagram, write your question, and use the hashtag #MedicalMyths. Did you find this show helpful? If so, please take a minute and leave us a rating on iTunes so that others can know. Thanks much, and I'll be back with you real soon. Bye-bye.